Welcome to Nourish MD, Doctor Dietitian Dialogues, where doctors and dietitians empower you about your health and discuss and provide a better path to health and wellness. Proudly presented by Concierge Medical Practice Private Physicians Medical Associates, PPMA, with your hosts, Registered Dietitians and Nutritionists, Papanos and Romana Brennan.
Hello, everyone, and welcome to the Nourish MD's podcast. Today, it is myself, Lauren Papanos, and Romana Brennan, both of you registered dietitians, and we're going to be talking about all things heart-healthy nutrition. We're really excited for this topic because I would say, I don't know if you agree with this, Romana, that this is probably one of the bigger conversations we're having with majority of patients.
Absolutely. There are a lot of questions about cholesterol and fiber and dietary changes for how we can alter these lab values that relate to heart health. So definitely something that comes up quite often.
Yeah. And there's so many things that can be done from a preventative angle, as well as things that can help support once we do see a situation where there is hypercholesterolemia, where there's high cholesterol levels, or where there's high blood pressure that's happening. And so Romana and I always like to look at labs and lab history because that helps us really understand, is this maybe something driven through genetic factors, or is it something that is more dietary related, lifestyle related? And what are the needle movers for you, the levers that we can pull to really see some improvement to not only cholesterol levels, but also things like your triglycerides and your blood pressure levels and your cholesterol metabolism. And I think it's really important that as we start out this conversation, that we first and foremost discuss that your liver makes cholesterol whether you eat it or not. Cholesterol is needed for all of your cell membranes. So there's actually virtually no way for you to completely affect your cholesterol levels through just modifying the cholesterol in your diet. But there are actually a lot of other variables that diet does influence when it comes to cholesterol levels. And two of those things that we're going to really get into today are going to be sugar and how that impacts your total cholesterol and your HDL, LDL cholesterol, triglycerides, as well as your blood vessel health and how that impacts things like blood pressure. And then fiber, because fiber actually helps us to be able to metabolize cholesterol better. And that metabolism of the cholesterol comes out your gut. And that's really important for the whole cholesterol balance of the body's production versus how much is being removed when we're talking about high cholesterol levels. So I think first and foremost, I just want to mention as well that it is normal for us to see increases in total cholesterol and LDL cholesterol happening as you get older. That's a natural evolution, if you will, of the aging process. And that is actually driven in part by the hormone changes that happen as you get older. For women, they go through something called menopause, and men go through something called andropause. They happen around the same time period, sometimes for men a little bit later. But really, this can be anywhere between 50 to 65 that you are going to see some of these hormonal changes happen. For women, you start to notice that some of your sex hormone levels, like your estrogen levels and progesterone, but also things like your thyroid hormone levels that are all intertwined in your whole endocrine balance, start to be affected. And when we start to see a drop off in estrogen levels, where those estrogen levels decrease pretty dramatically, as well as a decrease in your active thyroid hormones, and which that will show up as maybe an elevated TSH level, which stands for thyroid stimulating hormone, then we'll start to also notice a creep happen with your cholesterol levels. And this is actually a very normal process that does happen. And that's because these two hormones regulate your estrogen metabolism in the body. And that goes back to how balance of cholesterol levels really plays a big role in what your lab values look like. So it's important to note that it doesn't mean that we can't shift those levels. It's just important to know that if you're starting to see things climb up, as you're seeing that age climb up, that's a very normal progression that we do expect to see. So Romana, maybe you could first just kind of touch on some of the different types of cardiovascular factors that we're seeing, and what do we really mean when we're talking about cardiovascular disease?
I really appreciate you bringing in that hormone piece. As nutritionists, as dietitians, we love connecting the dots between these different body systems. So it's a really important piece to consider as we're getting older, as we're aging. What are our hormones doing, and how is that affecting other systems of the body, like the cardiovascular system? So when we're talking about heart health, when we're talking about the cardiovascular system, what does this even mean? When we're talking about cardiovascular diseases, majority of these diseases are preventable, or we can treat them or manage them in some way utilizing diet and lifestyle interventions. But when we're talking about these cardiovascular diseases, this is a group of disorders relating to heart health as well as our blood vessels. So we can think of our circulatory system, the way that blood is pumping through our body. How is this impacted by the quality of our blood vessels, just the rate at which our blood is able to move through our body? We have different systems that help regulate our blood pressure. So I would say a variety of some of these cardiovascular diseases that we see among our patient population: elevated blood pressure, elevated lipid levels, which could be your total cholesterol, LDL cholesterol. Maybe you have low HDL cholesterol, which we often consider to be this good type of cholesterol. Talking about triglycerides as well. So if any of these things are ringing a bell, these are all disorders, challenges, considerations relating to the cardiovascular system, coronary heart disease, peripheral artery disease. All of these different conditions are related to the cardiovascular system, which is all that we're focusing on today. So that being said, some of those initial considerations, of course, we know that smoking, alcohol overuse, any type of sedentary lifestyle, lack of physical activity can impact this cardiovascular system, our heart health, our blood vessel health, in addition to diet. Of course, diet plays a major role in helping not only to prevent, but also to help treat and manage these cardiovascular diseases, whether you actually have a cardiovascular disease or just in the context of overall heart and vascular health. So one of the first things that I always love to ensure, whether you are dealing with your cardiovascular health or not, is just ensuring that you're getting adequate vegetable intake as well as fruits, but really focusing on vegetables, in part for the fiber content, another part for the phytonutrients. We know that different colors in our fruits and vegetables offer us different benefits, different what we call phytochemicals, also called phytonutrients. These are different classes of chemicals that are in these plant foods that can be tremendously beneficial. So getting at least 5 servings of fruits and vegetables a day. I'm sure, Lauren, you would argue for more probably. But ensuring that we're getting enough fruits and vegetables is going to be imperative, again, for the fiber, for the different phytonutrients that are going to benefit not just our cardiovascular system, but also our other body systems. And just as we're aging, this is imperative. What are some of your favorite sources of fiber that we can get in our diet?
Yeah, well, we know when it comes to cholesterol in particular that the soluble fibers, which are more of the fibers that are a little bit more challenging to find in the diet, are going to have a bit more of an impact when it comes to cholesterol metabolism. And that's why if you've ever purchased Quaker Oats at any point in your life, you've probably seen on there that it says that this is part of a heart healthy diet. And although we might have our own opinions on Quaker Oats, they do have that on there because they are a soluble fiber source. Oats are a soluble fiber source. Now, when it comes to other soluble fiber sources, some of my personal favorites are seeds. Seeds can be things like chia seeds, flax seeds, sesame seeds, hemp seeds, and also legumes. And legumes include things like your beans and your lentils and your chickpeas and all of those guys that for some of us cause some of the bloating and gas, but that could be something that we can help you fix related to your digestion, which we'll talk about in a future upcoming podcast episode. But those really are so incredible for overall cholesterol metabolism. There's also another type of fiber. And as you mentioned, when it comes to these plants, it's not just the fiber. There's also other compounds that are in these plants that are really great for your cholesterol levels. But there's another component that are called plant sterols. And there's a lot of crossover in these types of foods. But plant sterols are found in a lot of your nuts and seeds. And those have also been shown to help lower that LDL cholesterol. So those are also another really great fiber-rich option. And whether that is incorporating seeds into salads or or doing a chia seed pudding or a smoothie that has seeds in it. I really love them for so many different reasons, to provide the minerals that you need for just healthy body in general, but also cholesterol levels, and also the fibers that are going to help with that cholesterol metabolism. So we talked about the role of fiber and plant sterols when it comes to your cholesterol levels, but there's other things outside of just these plant foods that are really important for us. Maybe you can talk a little bit about the different types of fat sources and how those impact cholesterol.
Oftentimes, nutritionists, dietitians, we throw around, eat your healthy fats, but what does that actually mean? So we know that we have saturated and unsaturated fats. Our unsaturated fats are primarily what we're going to be finding in our plant foods. Granted, all of these foods have some ratio of saturated and unsaturated fats, as well as within that unsaturated fat category, we have what we call polyunsaturated fats and our monounsaturated fats, just describing the rate to which they have different hydrogens on them. But we want to make sure that we're getting enough polyunsaturated fats in particular, but we can also have monounsaturated fats in fantastic foods like avocado, olives, things like that. So when we're talking about healthy fats, we want to ensure that we're getting enough of these essential fatty acids, which are a type of polyunsaturated fat. Omega-3s are a type of essential fatty acid, which is a type of polyunsaturated fat. And we want to ensure that we can get these to a great extent in our diet to offset what we call omega-6 fatty acids. So how do we get our omega-3s? We have them in the seeds that you were talking about, Lauren, some of those flax seeds, chia seeds, things of that sort, as well as walnuts. And we can also get that through fish as well. So I know I had mentioned that a lot of those unsaturated fats are in our plant foods as opposed to animal foods, but we can also get some great omega-3s from fatty fish like salmon, halibut, things of that sort, or a fish oil supplement, which we can touch on later today. But we want to make sure that we're getting enough healthy fats. If you can utilize any avocado oil, olive oil, extra virgin cold pressed, of course, olives as a food source as well. So just ensuring that we're getting enough of these essential fatty acids in our diet through some of those foods that I had mentioned.
And we'll touch on this a little bit further in our group session this month, but that some people are more sensitive to saturated fats than others, and saturated fats are what are in animal products. And there's, I think, a lot of confusion out there about that saturated fats are problematic for everyone when it comes to cardiovascular health and cholesterol levels, but that's actually not the case. There's a genetic variable that's called ApoE that you can actually test for, and ApoE actually tells us how your body metabolizes fats, in particular saturated fats. And for people that have ApoE, specific types of alleles of ApoE, which is just something genetic that you inherit, they may need to restrict saturated fats in the diet more than those that don't have it to be able to support healthy cholesterol levels. And saturated fats, like I mentioned, are what are in animal products. So anything that's made from an animal that has fat in it, whether it's dairy or red meats or, even chicken thighs and things, right? Those are all going to have saturated fats in them. But as I mentioned, we'll cover ApoE and what are some of those variables that you should look out for if that is something that you are dealing with.
Yeah, absolutely. And even if genetic testing isn't something that's available to you right now, bottom line, research has shown, even with this controversy of whether saturated fat is bad or good, or whether animal products can contribute to a heart healthy diet, there has been research conducted widespread over the entire world that helped show us that it's really the quality of the nutrients that you're ingesting as opposed to whether you are fully plant-based, vegetarian, vegan, or including animal products. So kind of the takeaway from a good chunk of the research is that you certainly, if you have a plant-based diet, as long as you're prioritizing whole foods, fruits, vegetables, like we had mentioned, the benefits of the fibers and the plant sterols and the phytonutrients in those whole food plants. And then if you wanted to incorporate some high quality animal products, whether that is dairy, grass-fed beef, things of that sort, that certainly can still be part of your health promoting diet as well.
Discover the wellness you deserve. At Private Physicians Medical Associates, PPMA, you'll receive personalized premium preventive care and one-on-one medical attention with an emphasis on prevention, nutrition, and wellness. Extended office visits, appointment availability, 24/7 physician access, limited patient enrollment, PPO insurance and Medicare accepted. This is concierge medicine. This is medicine the way it should be. Call today for a free consultation at 949-566-8179.
So another dietary consideration, and this can kind of take us into talking about insulin as well, but we want to make sure that in order to promote a heart-healthy diet, we are limiting, if we can eliminate it, but definitely limiting those ultra-processed foods, those refined carbohydrates, processed meats, as well as the sugar-sweetened beverages. Sugar-sweetened beverages can be a big needle mover in terms of how much added sugar people are getting in their diet. Of course, we want to make sure that everyone is appropriately hydrated, so getting enough water. So if we can just swap those sugar-sweetened beverages for water or another type of less sugary option, herbal teas, things of that sort, I would say that that's another one that I recommend to individuals often who maybe aren't getting that hydration that they need, and also just limiting the sugar.
Yeah, I mean, and even like a step deeper than that, right, is that blood sugar metabolism, your ability to metabolize sugar as you get older becomes very, very poor. And that's because of the hormonal changes that happen in the body as we age. And so some individuals may even notice that, they're not drinking sugar sweetened beverages. They're not consuming sodas. They're not eating a high sugar diet, but maybe they're even getting in too many starchy vegetables or grains and things in the diet that are still contributing a decent amount of carbohydrate, or the way in which they're eating those foods is not properly balanced. And so they're getting big blood sugar excursions, we call it, where there's a very large blood sugar response that's happening after that meal. And that is contributing to elevated triglycerides, as well as dropping their HDL, increasing LDL. And we know that insulin is the hormone that is made by your pancreas that helps your body when you consume any of these starches or fruits, anything that has carbohydrate in it. Insulin is that hormone that's going to help take that sugar and bring it into the tissues in the body, the cells that utilize that sugar. They're dependent off of it. And, this is a process of many years, but as we get older and those sex hormones like estrogen and thyroid hormones and things drop off, then you start to notice that insulin just starts to creep up very, very slightly. And eventually what happens is that you actually don't make enough insulin. And now we've got really elevated blood sugar issues that are contributing to these issues within your cholesterol levels. So it's very common to see those blood sugar issues happening at the same time that we're seeing cholesterol issues occur. And that's something that we call metabolic syndrome that we're not going to touch on too much today. But that really just explains the interplay between the role of really healthy blood sugar metabolism and blood sugar levels, and also cholesterol levels. And you would be surprised that even just these, healthy food sources, if they're not eaten in the right quantities or paired together properly, can cause some of those larger blood sugar elevations that are going to then impact your cholesterol levels.
Definitely something that we need to take into consideration together. These are not completely separate issues, right? And we know that can also lead to inflammation, which we will address in a future episode. So be sure to check that out. Any other additional dietary considerations, Lauren, that you think is important when it comes to heart health?
Well, we know that, as you mentioned, the role of your blood vessels and your endothelium is really important when it comes to your risk for a heart attack and for a blood clot. So we need to be talking about ways that we can support the endothelium and that we can support blood flow. And two of the ways that we can do that, one of my favorites, is through something called nitrates. There is something called nitrites that's very different. Nitrites are a preservative that is used in meats. Not talking about that. We're talking about nitrates. The difference is just an A versus an I. And nitrates are what are naturally found in foods, primarily dark leafy greens and beets. And nitrates are a vasodilator, very similar to the role that omega-3s have. And what that means is that they open up or dilate our blood vessels. And when we have this dilation effect happen, then blood is able to flow more easily. And there's a reduced risk of something like a blood clot happening, right? So nitrates are incredible. There's tons of research on their role in both in reducing blood pressure, but also in aerobic exercise performance because of that role that they have on blood flow. And these are things that you can incorporate through food sources, or you can also purchase them as supplements and incorporate a beet powder or a greens powder. The one thing that's really important to know is that you actually make these nitrates through your saliva. So if you are using any alcohol-based mouthwashes, you're going to negate all of that blood pressure improving benefit that you would get from these nitrates. So it's really important that if you are trying to improve your cardiovascular health through incorporating a lot of these food sources, that you're not killing those good microbes in your mouth through alcohol-based mouthwash, because that is going to limit the effect that it's able to have in your bloodstream as well as in your digestive system. Other mouthwashes that are not alcohol-based could be a fine option. That's something you might want to talk with your dentist about, is what are some of those great options for you. So that's nitrates. Outside of that, there is supplementation that can also support your endothelium. One of those that I really love is called Arterisol HP. And some of our patients that might be listening to this might have heard of it before, that, might be something that I've recommended for you. And this is actually made from a specific type of seaweed that they extract from the ocean that has this type of compound in it that helps to be able to restore your endothelium. And your endothelium is really important for that healthy blood vessel and blood flow in the body. So those are kind of two of my other favorites. And I think it's also important that, as we're having this conversation, that we also discuss the role of sodium, because sodium and potassium are two electrolytes that play a really significant role in that blood flow and blood pressure piece of things. So maybe, Romana, you can touch a little bit more on the role of those two electrolytes.
Sodium does get a little bit of a bad rap when it comes to heart health. One thing that I wanted to mention was just that in terms of sodium and potassium. So first of all, what do they do in our body? They both help regulate our fluid balance in the cells. So the way that fluid is able to enter and exit our cells, it impacts our hydration status, it impacts our blood pressure. So that's why typically we hear that if someone has elevated blood pressure, to reduce our sodium, because if we have too much sodium, then it can lead to this blood pressure elevation from an increase in that fluid volume in the bloodstream. And our blood pressure not only is regulated by just the presence of these electrolytes, right? Like we have systems in the body, namely our renin, angiotensin, aldosterone system, or the RAS system. And sodium, and as well as these other electrolytes, play an important role in this system as well, in order to ensure that our fluid balance is regulated. So if we notice higher sodium, that system is going to ensure that we are excreting sodium in the urine. And so it uses this really important checks and balance system. However, when it comes to sodium and the recommendation for a low sodium diet is due to the fact that what we call our standard American diet, high in processed foods, tends to be high in sodium, but low in potassium. And so it's when we have this high sodium, low potassium, that's kind of this dangerous combination for heart health. And when it comes to the standard American diet, salt is a really important preservative for foods. So in order to ensure the longer shelf life of some of these packaged goods, more often than not, they're adding additional salt. And then low in potassium, because we know that the standard American diet is not meeting the recommendations for fruit and vegetable intake. And that's where we're going to get a lot of our potassium. But we need to ensure that these electrolytes are balanced. We want to make sure that we can still have sodium in the diet so long as we are balancing it out with this potassium, other electrolytes such as calcium, magnesium, chloride, things of that sort. So salt can play an important role in the diet so long as it is balanced. Lauren, do you want to kind of piggyback off of that?
Well, I think that it's important to note that you need salt, and that the solution is never in removing sodium entirely from the body, which I think a lot of times people do because there can be fear mongering that occurs around sodium. And, it's evidence-based that sodium does increase blood pressure. It does create constriction. So you're going to see an acute response of blood pressure increase whenever you do ingest a large amount of sodium. So that is something that will occur. But what that information is not saying is that if it is balanced properly with its little electrolyte friends, things like potassium and magnesium, that actually is what helps neutralize that blood pressure response from occurring. And just because you see a little bit of a blood pressure increase doesn't mean that it's creating a chronic high blood pressure state. And the variable that I see that moves blood pressure the most in terms of individuals that have high blood pressure, that we are trying to reduce their blood pressure, is going to be improving their blood sugar control and improving their physical exercise. Those two go far further than making any type of tweaks into your sodium. And it's also important to note that when we're talking about sodium, that we're not talking about your refined table salt that you get in the little white shaker cup at the diner. That's not what we're talking about. We're talking about an unrefined salt that has trace minerals in it. Celtic salt, it could be Redmond's real salt, are two of our favorites because they don't just have sodium in them. They also provide you a little bit of those other minerals that come alongside of sodium. And when those are in conjunction with the sodium, like we said, you're going to see a much less significant blood pressure response from ingesting that salt.
We know that these minerals serve as really important, what we call like spark plugs for each of the chemical reactions in our body, for metabolism, for example. And when we're in a state of stress, which, whether that is from inflammation or any kind of underlying chronic disease, our body uses up these minerals quickly. And so we want to make sure that we're still replenishing that so that we can better regulate our blood pressure and ensure that these chemical reactions that are happening, whether it's related to metabolism, for example, that these are happening efficiently with the appropriate level of minerals.
So I think let's just kind of round it out today with talking about some of the role of a couple of the vitamins that we mentioned. And we can take a deeper dive into some of these in our group session later this month. And we'll also be talking about some of the lifestyle changes and really just more of the practical strategies of how to incorporate all of this into just your day-to-day life. So, we mentioned earlier the role of omega-3 fatty acids. And I think it's really important to understand that those are an essential fat, which means that they have to be incorporated through your diet. Your body cannot make them. Remember, your body has its own capacity to make things like cholesterol and a lot of other substances in the body. It doesn't have the ability to make these essential fats like your omega-3s. And I would say that those are probably one of the most evidence-based nutrients, whether through supplementation or food sources, when it comes to improving all of these variables of your heart health, cholesterol, triglycerides, blood pressure, all of those together. So those are a really important supplement if you're not incorporating enough of them. I will tell you that in all my years of practice, I have never seen anyone who is able to achieve adequate omega-3 levels through just eating omega-3s in their diet. It's not possible. I've never seen it. You have to be supplementing with it. So that's really important to understand. And a regular supplementation and enough, and the quality of your omega-3s is so paramount, because these are fats, which means that they're oil. They go rancid very easily. They oxidize very easily. So we don't want to just be going to, the supermarket, Costco, and buying whatever fish oil we can find. Really prioritize the quality when it comes to those omega-3 fatty acids. And just note that if you have a history of high cholesterol, you have a familial history of these things, you're probably going to need more than just what it says on the bottle to be able to see some of these benefits that we're talking about. And that's where scheduling an individual appointment where we can really look at your labs and understand what your individualized need further is going to be really critical.
Just a quick note about omega-3. So omega-3 is often referred to as a fish oil capsule, but if you are someone who is vegan, vegetarian, there are algal DHA, for example, just to make sure that you are still getting an appropriate level of omega-3s. And if you need to supplement, but you are doing more of a plant-based diet, there are still options for you. Another supplement that I especially like to recommend if someone's taking a statin is a CoQ10. So CoQ10 is an antioxidant. It works synergistically with statins. So not only does it help support the body in its antioxidant effect by neutralizing what we call free radicals, but it can even help prevent against any damage that these free radicals can cause and just help with energy production in the cells. It's also been shown to prevent blood clot formation. So overall, as an antioxidant, important, but especially important if you are taking a statin. Another supplement is soluble fiber. So Lauren, as you were describing the importance of soluble fiber, if soluble fiber is something that is difficult for you to get in the diet, or you need a little bit extra support based on your cholesterol levels, there are certainly options for you with taking like a soluble fiber powder in the morning, just to help bind up some of that cholesterol, which again, I know you'll get into at another time. Any other supplements that you wanted to mention, Lauren?
There's also L-arginine, which is very similar in how it works to nitrates. L-arginine is an amino acid that you can purchase and take in replacement of nitrates. But there's tons of companies out there that are selling nitrate juices that are concentrated and nitrate powders that help to be able to support that vasodilation response. So like we mentioned, we're going to get into some of these topics as it relates to really modifying those cholesterol levels further in our group session this month. So if you are a PPMA patient, we invite you to join us as we will be diving just a bit deeper than today's podcast episode. But hopefully today's episode was a really great just overview of some of the dietary and lifestyle things that impact cardiovascular health, and also clearing up some of the confusion around diet and your cholesterol levels, because I don't know about you, Romana, but I know that I hear a lot of confusion around cholesterol in the diet causing high cholesterol levels and salt causing high blood pressure. And there's just so many other variables when it comes to these that we explore today that hopefully provides you a lot more of a clear understanding of some of these dietary changes that you can make. So thank you guys so much for being with us today, and we will see you guys back in 2 weeks.
Thank you for joining us for today's episode of Nourish MD, Dr. Dietitian Dialogues. This podcast is intended for general educational purposes only. It is not a substitute for professional medical advice. Please consult with your healthcare provider before beginning any nutrition or supplement recommendations. Sign up for our mailing list so you'll never miss an episode of our wellness journey. See the podcast description for the link.